Hi, my name is Amanda Frostad, and this is my assignment for Social Work 508 Diagnostic Process, Professor Destiny Cormier, LMSW, and I am doing a recording of my reactions for Robert Whittaker's book. So this is the book, Anatomy of an Epidemic, and here goes. I'm using my laptop as reference because I typed everything before I'm going to say it. So, question 1, your reactions and understandings of the book. I personally didn't enjoy the book. I thought it was a very dry read. My first reaction to the book was that a conspiracy theorist wrote it. On page 23 of the text, when we're learning George's story, it says, given that his recovery started when he stopped taking his medications, is it possible that some people who are ill with serious mental disorder like schizophrenia or bipolar illness might recover in the absence of their medication? And this really got me thinking in the same way that I would have if I was watching a conspiracy documentary, you know, making me question everything that I've come to know to be true. There were a lot of statistics thrown out really early in the book. It did get me thinking that we are over-medicating our society, and I do believe that this is true. But it also kind of makes me feel bad because I'd like to think that medication was created to make people better, but after reading this book, it really makes you take a second look and think that medication's more for pharmaceutical profit. It's kind of scary to think that medications that I thought were safe for so long, some of which I myself have taken, might not be safe. So in Kathy Levin's story on page 20, there was a statement made that grabbed my attention. It said she experienced terrible side effects due to her prolonged exposure to certain medications that were irreversible. And Kathy herself said, they don't have any sense of how these drugs affect you over the long term. They just try to stabilize you for the moment and manage your symptoms from week to week. That's all they ever think about. So that in itself is kind of scary. Question 2, as we are still unsure about the exact causes of mental illness, how will you respond to a client who may ask you about the cause of a diagnosis that they have been given? So if I had a client personally that asked me the cause of their diagnosis, I would tell them that there may not be an answer because we haven't found the cause for a lot of different diagnoses such as autism and schizophrenia. But there has been a genetic component found for a lot of these illnesses. One of my references is my supervisor, Laura Chenard. I asked her the same question, and she said, I would say it depends on the client and their mental status when they ask. I'd explain that there are many reasons for mental illness, such as biological, trauma, hereditary, etc. I may also say to a lower functioning client that a diagnosis gives them a reason for the behaviors they experience, but it does not define who they are as a person. It all depends on their level of comprehension. Also, my second reference to this question is Ellen Sachs' book that we read in class. So I said if Ellen Sachs asks me about the cause of her diagnosis at some point throughout the text, I would tell her that there really is no way to know. I'm not going to lie to my client and act like I know something that I don't, because that would make me unethical. Personally, I would guess that Ellen's diagnosis might have a bit to do with the trauma that she experienced as a teenager going to the outpatient rehab, but again, there really is no way of knowing. I think my supervisor, Laura, said it perfectly when she said, your illness does not define you. Sometimes there is no reason why things happen, and that's okay. What we need to focus on is how we handle the cards that are dealt to us instead of focusing on the things that we could have or should have done, because it's in the past and irreversible usually. So, question 3, your thoughts about the recovery model and how you would use this in your practice. For a lot of people with mental illness, the whole idea about recovery is being in control of your own life rather than go back to a pre-morbid level of functioning. And I believe that this approach, which does not focus on fixing all of your symptoms, but focuses on resilience and control over the problems itself, is safe. I would say that the recovery approach argues against just treating symptoms because focusing on building resilience of people with mental illness and supporting those in emotional distress. And that was taken from ncbi.gov. See that in my references page. I also did further research, and I found a statistic from members of the Provisional Advisory Council on Mental Health. And there's just 4 different quotes from people that were taken at this convention in December 8th, 2005. Their question was, what is recovery? Number 1 said, achieving a self-satisfactory label of daily functioning in all areas of life. I think that's great. Number 2 is recovery is initially healing and returning to an acceptable previous state of health. It then becomes transforming. That's great. 3 is recovery is an ongoing process, and it involves all senses, physical, emotional, mental, spiritual, and finding empowerment to reach and maintain a sense of worth in the community of life. And 4 is recovery is a process where a person suffering from mental illness is able to regain their self-confidence and have as near social relationship as possible and have meaningful jobs. I agree with all of these things completely, and in my opinion, if you are treating anxiety with medication but not treating the cause of the anxiety itself, the anxiety will never go away. But if you follow the recovery model of treatment and you're treating the problem as a whole and being resilient to your diagnosis while treating the symptoms, the recovery model is, in fact, very significant. I think it's a great style of recovery. Number 4, the impact of stigma and discrimination on people who have mental illness label, and identify what you as a social worker can do to change this. So again, I pulled from ncbi.gov, and it will be in my references page. A little bit of information. You know, many people with serious mental illness are challenged doubly. This website specifically said, on one hand, they struggle with the symptoms and disability that result from the disease, but on the other hand, they're also challenged by stereotypes and prejudices that result from misconception about mental illness. As a result of both of these things, people with mental illness are often robbed of the opportunities that define a positive quality of life. Things such as, you know, safe housing, satisfactory health care, good jobs, you know, any affiliation with a diverse group of people, really, they are robbed of. I also pulled from the integrationsamhsa.gov website. One thing that I think social workers can do to change this is motivational interviewing. I am a huge fan of motivational interviewing. I believe that playing on client strengths is a great way to take away stigma in their minds, because it gets them to see what they're really good at and not just be the diagnosis that they think they are sometimes. So it says motivational interviewing is a clinical approach that helps people with mental health and substance disorders, other chronic conditions such as diabetes, cardiovascular conditions, and asthma, make positive behavioral changes to support better health. The approach upholds 4 principles. There's expressing empathy and avoiding arguing, developing discrepancy, rolling with resistance, and supporting self-efficiency, which is, you know, again, the client's belief that he or she can successfully make the change. Like I said, I'm a huge fan of this. I think that motivational interviewing is really the way to go with clients that are plagued by stigma. I use motivational interviewing daily in the work that I do. I'm just a big fan of it. So, number 5, how this book and your additional research has influenced your thoughts about mental health. So, on mentalhealth.gov, I found an article that says mental health includes our emotional, psychological, and social well-being. It does affect how we think, feel, and act, and it also helps determine how we handle stress, relate to others, and make different choices in our lives. Mental health is very important at every stage of life, from childhood to adolescence. And over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, and family history can all lead to mental illness or trauma of some sort. Mental health problems are common, but help is available, and I have some websites that are in my reference page about that. I know that in mental health, positive and negative is important, but I'll be honest, with the Woodtaker book, it kind of made me mad. I get the impression while reading this book that the author does not believe in mental illness as a real problem, but that he believes that it's just another way to make money, and I think that's wrong. At the very beginning of the text on page 5, he talks about how we should expect that the number of disabled mentally ill people should decrease since the introductions of antipsychotics and medications such as Prozac, but they have done the complete opposite, and mental health numbers have skyrocketed. While this may be true, This text is not taking into account the number of people who are medicated but are not seeking or attending therapy. And I think that we really need to take a look at this as a whole. I think this text is very one-sided because it doesn't talk about the clinical interventions of things. It just talks about medication. So this again goes back to the recovery model. We shouldn't just be treating the symptoms, we should treat the problem as a whole. And finally, number 6, the take-home message from your readings and research. The takeaway message that I get from this text is that our society is over-medicated and that medication is a huge moneymaker in the United States. The text even says, and I quote, "Our society believes that psychiatric medications have led to a revolutionary advance in the treatment of mental disorders. And yet these pages tell of a drug-induced epidemic of disabling mental illness." I don't necessarily agree with this. I think there are instances where medication does induce mental illness, such as delusion, psychosis, etc. However, I do believe that mental illness itself is almost always caused by something other than medications, and we should take a look into that side of things. My personal take-home message is that this book is a bit negative, and it suggests that mental illness doesn't exist to the extent that our society believes that it does. My whole career is geared towards caring for people that are mentally ill, so I choose not to take this lightly. The note that I would like to end this on is that mental illness is exhausting, but there are ways to have positive mental health overall, which the majority of people in this country do. And according to mentalhealth.gov, positive mental health allows people to realize their full potential, cope with the stressors in their life and work productively, and make meaningful contributions to their communities. Some positive ways to maintain your mental health could be, things that we all do in our everyday lives: developing coping skills, getting enough sleep, helping others, staying physically active, staying positive, connecting with others, having meaningful relationships, and getting professional help if you need it. That being said, I would not suggest this book to anybody. I think I've made that pretty clear. However, I do think that it is a good text for this class because while it is a pretty dry read, it's very eye-opening, and I think that everybody should see the medication standpoint. So that's it.